I'm Stephanie, and this is my husband, Donnie. For the purpose of this assignment, he is going to be my patient, and for the purpose of my teacher grading this. Do you consent to having this head-to-toe assessment completed?
I do.
Perfect. So first I'm going to provide privacy. We're just in our living room in our home. Wash my hands with alcohol-based cleanser and provide instructions to Donnie about what we'll be doing. We're going to be doing a head-to-toe assessment. So first I'm just going to assess his body. From the look of him, he is a normal weight, height. His skin is intact, no abrasions, no lesions. He is normal ethnicity. I'm just gonna just uncross your arm. I'm just gonna feel your arms here and your skin. His skin is warm, it's dry, no moisture there. He's got good skin turgor, perfect. It collapses within less than a second. Just gonna check his cap refill over here. It's less than 2 seconds. Alrighty. So next I'm just gonna assess your eyes. So you can take a look at me. So I'm just gonna take a look at his eyes. I'm looking at his conjunctiva, his sclera, and his pupils. His pupils are equal, they're 3s. He's got good sclera, it's white, and it's glossy. So next I'm just gonna, I need your phone. Next I'm just going to take a look at his eyes with a flashlight. So you look directly into my eyes, and I'm just going to check for reactivity. Perfect. Wonderful. So both pupils react. They go from a 3 to a 2, which is great. So next I'm going to check your accommodation. So you follow my finger. Both eyes go in directly, which is great. So he has perla. So I'm going to get you to look up just with your eyes. To the left, to the right, down, left, to the right. Eyes move well together, no nystagmus. So next we're going to check your confrontation. So you can cover one of your eyes. And you're going to tell me when you can see my fingers, okay?
So I can see them. I can see them. I can see them.
Okay, and your other eye? Perfect.
I can see them. I can see them. I can see them.
Perfect. So just checking your peripheral vision. Everything looks good there. So next we're just going to do the Schnell chart. So you can go back 20 feet, so back here. And I'm going to get you to look at this here. And I want you to read the one for 2020. So these letters here.
I don't know if I can read those.
Try.
E.
Okay, go up one.
F.
B, no, E, L, O, P, E, D.
So he has 20 out of 25 vision. So not quite perfect. So it looks like you need an eye test after all. Okay, come back in. So next I'm going to inspect his ears, so you can take a look at the camera here. So I'm looking at his ears. There's normal, there's no drainage. Both of them are the same. They're warm to the touch. He has no pain or discomfort with me touching them. So I'm going to look at his pinna, pull back to look inside, nothing in there. His tragus looks good and healthy. So I'm going to do a whisper test. So you can put one finger in your ear or behind your tragus. And I'm going to do a whisper test. So you tell me what I say.
5EA.
Perfect. And your other?
7B7.
Perfect. So wonderful. So your hearing is good. So next I'm just going to check out your face. You can look at the camera. That's okay. I'll look at you here. So can you smile? Can you frown? Stick out your tongue? Good. Perfect. Everything looks symmetrical. He's good. Can you swallow? Perfect. No issues there. Everything looks great. So next we're going to do finger to the nose test. So you can follow, touch your finger to my finger and then touch your nose. Okay? Perfect. He's able to do it without any difficult. And with the other hand. Perfect. Good. So no difficulty there at all. So next, while you're standing here, I'm just going to, if you want to face me, do a little bit of muscle test. You can put out your arms. I'm gonna touch the guts here, pull up, perfect. And then the other way, wonderful. Hands up, touch your hands and back, perfect. You can lie down here. So for his power of his upper extremities, he is 5 out of 5. Thank you.
Okay.
You can push against my feet, perfect. And the other way, wonderful. So he's got 5 out of 5 power as well. Can you lift each leg? 10, 9, oh, sorry, for 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And the other one, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Perfect. You can stand back up. You can close your eyes, face the camera, and just stand there, and we're just gonna take a look at you. He's not swaying, his ROM vertex is negative. That's perfect. So next we're just going to check his reflexes. So we're gonna check your arm here. So we're gonna check your brachial. Great too. His brachial. Hey, that one did good. Great too. Okay, perfect. You can lie down there. All of them are great too.
Try this
No,
one.
no, go ahead, lay down. Okay, so you can bend your knee up. Next, we're just gonna test your popliteal, perfect, and your Achilles. Nope, like that. So this one here foot's supposed to go down. So if you get a positive test for that, then it would drop down. So 2 out of 2, all of his are great. You can take a stand. So next we're gonna do his respiratory assessment. His breaths are easy, they're normal. He's not having any difficulty with his breathing. His chest is symmetrical. No cough, nothing like that. So just looking at his chest here, everything looks good. So we're going to take a listen to his chest. So the first area that we're going to take a listen to with the diaphragm is up in his, above his clavicle here. So we're gonna take a listen for bronchial noises, just easy, normal breathing. And then we're also gonna take a listen with our belly. We're comparing side to side just to make sure that everything sounds the same. So we're gonna start on either side of the sternum, so we can go left to right. And we're gonna start at the second intercostal space, just normal, easy breathing, going down per intercostal space, going across. We're also gonna check mid-axilla. So his chest sounds great. He has easy breath sounds. He has no adventitious sounds, no all vesicular sounds. It's clear. You sound great. Turn yourself about. Facing the camera. So, yep, right there. So next we're going to listen to posteriorly. We've already listened anteriorly. So we're going to start again up at the top here to listen to his lungs. So we're going to listen above his clavicle. Either side to listen to his apices, moving our way down through each rib, second intercostal space on each side of his spine to be able to hear. On his left side, we'll be listening to 2 lobes. On his right side, we'll be listening to 3. His chest is clear, everything looks good there. So you can turn yourself about. So we're going to be taking a look at his, you can uncross your arms here, the cardiovascular health. So we've already looked at his capillaries. Refill, it was good. We're looking at his pulse here, it's regular, everything sounds good there, feels good there. For edema here, we're just going to check his feet, do a pitting edema test. Both of them look good, his feet are warm, they're great. While we're here, I'm just going to feel for a pulse. So I'm going to feel for his dorsalis pedialis, everything feels good, it's a 3. And listen, feel here again behind his posterior tibial, everything feels good there. A good pulse, a 3. His popliteal, a little bit weaker, I would say like a 2. We felt his radial there, so we're going to take a listen to your heart. So we're going to start at the second intercostal space on the left-hand side beside his sternum, and we're going to listen to the aortic valve. We're going to move across our weight, still on the second intercostal space, and we're moving to the pulmonic valve, and on the opposite side of the sternum, down to the third intercostal space. We're going to listen to Erb's point. Down to the fourth intercostal space, we're going to listen to I'll get back to that one. Underneath his breast tissue here, and the fifth intercostal space, mid here, we're going to listen to his mitral valve. So under the mitral valve, we're going to listen to this for a minute or so to listen to the aortic area. At this point, we're going to hear for S1, S2. We can also listen with our bell to be able to identify if there's any murmurs, which he doesn't have any of those. What else do we need to do?
Fourth intercostal.
Okay, honey, you take a lie down. Next, we're going to look at your belly here. You can keep it down. So his belly looks normal. It's flat, not rounded or distended. So first I'm going to take a listen here. So I'm going to start on the right side, his right upper quadrant, and listen to his left upper quadrant, to his left lower, to his right lower. So we're listening for up to 5 minutes if you can't hear any vowel sounds. Next, we're going to percuss in the same pattern. Normal, no issues there, tympanic. We can check for ascites as well, lack of ascites. Next, we're going to palpate in the same pattern. No deep palpation for this exercise at this time. Nothing is auscultated or felt. So you can stand back up. So for his joints, there's no swelling. Everything looks good. He has no complaints there. His gait, you can take a little walk, is steady. His gait is normal. Come on back. So next, you can face the camera here, Jenny. Head down to your chest. He can go all the way down. Neck forward, neck straight up, and straight back. He's got good flexibility there. Yeah, to the left and to the right as well. Perfect. He has less flexibility here, but he's got a bigger neck with some muscle there. So you can lean forward and try and touch your toes here. He's got great spinal flexibility. Wonderful. No kyphosis, no scoliosis. Straight is straight. So that concludes our assessment here. Thank you so much.